2 in 3 Australian adults and 1 in 4 children are overweight or obese, which can lead to increased risks of heart disease, cancer and type 2 diabetes. Many health professionals have told us for years that weight loss comes down to a healthy diet and exercise. To discuss some new findings, I'm joined live by National Health reporter for News Corp, Sue Dunlevy. Great to see you this morning, Sue.
Hi Janie, how are you?
Very well indeed, thank you. So a couple of articles that you have written in the News Corp papers this weekend. Firstly, the one today. So is it actually possible to lose weight without going on a diet or needing to exercise?
Well, I think most obesity experts would tell you that is the way to do it, that what you have to do is change your lifestyle rather than go on a diet. There's a lot of evidence that yo-yo dieting doesn't work because your body essentially defends the weight you used to be. So you might lose weight in the diet for 3 months and then gradually put it back on unless you change your lifestyle forever. And I think that's what we found from some of the case studies we spoke to who'd done a Weight Watchers program. They found that what worked for them wasn't just a 3-month diet, but changing their lifestyle forever, changing everything that was in their cupboard, and making sure that they had lots of very healthy, low-calorie meals they could access quickly from their freezer, or they'd make one salad and portion it up for 7 meals during the week, so they just had to grab and go rather than rely on takeaway food. And it's all about switching your diet to real foods, not buying processed foods on the shelves. That's what Rosemary Stanton, who's helped develop our National Health and Medical Guidelines, would say. And I think what was interesting about the series is that we found how we got to this stage, that I think on average we're eating about 300 more calories now than we did, nearly a century ago. Rosemary Stanton had some figures from 1938 from the Australian Bureau of Statistics, which showed, how much more potatoes we're eating a year. A soft drink, for example, in the 1960s, a 750ml soft drink would have fed a family of 4. Now we drink that in one sitting for one person. So that's where the extra weight's coming from.
Yeah, you talk about portion size. You also talk about vegan. Is it a healthy option? And also protein. We do hear a lot of fad diets out and about, and a lot recently, I would say, about high protein diets. What did you write in the article about protein and how much we need?
Yeah, so Professor Stephen Simpson from the University of Sydney has been testing a range of different diets to see what works in terms of fats, carbs and protein in helping you lose weight. And I think his initial studies in mice found that the low protein diets were very good for helping you lose weight, but the ones that helped you live longest actually were the higher quality carbohydrate diets. So the mice who were on those lived a bit longer. They were a little tiny bit fatter, but they lived longer. Now he's sort of researched more into protein, and his conclusion is that, yes, it's critical to your diet because what your body is seeking when it's trying to eat food is to meet its protein needs for the day. And if you can't satisfy them, you might overeat on other things. But the problem is that the modern food industry has kind of hacked our biology. So it's made food that tastes like protein that isn't protein. So you're talking about things like umami flavoured crisps and, those snack cracker biscuits that have got lots of salt and fat, and add a bit of sugar, he says, and you get kind of the bliss point. And our body thinks it's meeting our protein target when we eat those, but in fact it isn't.
And also there's some new breakthrough medicine in terms of losing weight as well, some pills, and you've done some research, certainly with mice and so forth. We are running out of time, but just quickly, what are some of those findings?
So that's from the Garvan Institute, and what they found is a chemical that turns a process that stores fat into one that burns fat. And that could be the key to a magic obesity pill, hopefully, in the future, when we turn that process on its head and instead of storing fat, we're burning it.
Well, there's certainly so much information, and on the screen it says more sleep can certainly help you lose weight as well. Lots of great tips and information in the News Corp articles from yesterday.
Go by the Daily Telegraph and the Herald Sun and read all about it.
There you go. Thanks so much. Great to see you, National Health reporter for News Corp, Sue Dunlevy. Take care.
Bye-bye.